For the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Invocation of First United Methodist.
Before the prayer, Mr. Mayor and members of the City Council, before I offer my prayer and blessing, may I just give you a personal word of thanks. This is the last regular meeting of the City Council, as I understand it. It's been quite a year. It's been quite a journey. More challenging year than any of us had anticipated. And yet you've continued to show up, listen, discuss, and make the best decisions you could for what you thought was best for the good of this community. I only have several hundred people that I try to keep happy in my church family. You have several thousand that you are trying to keep happy. I'll keep my job. I'll let you keep yours. Thank you for the work, the energy, the commitments, and prayer that you have brought to this job. Let's pray. God of all grace and love, we give thanks for the gift of this day. I give thanks for the men and women of the City Council and city staff who work hard on behalf of this community. In this season of Christmas, may your gift of love be felt in every home in our area. We lift up to you those who are ill in our community. May your healing touch be present. We pray for those who are grieving the loss of a loved one. May they know they are not alone and also sense your loving embrace. I ask that your blessing would be upon these leaders as they gather this evening. Give them wisdom and discernment as they continue to provide leadership, and give them strength for the journey ahead as we prepare to enter a new year. And most of all, Holy God, I pray that Christmas joy and hope would rest upon each and every one of them. Amen.
Thank you. Roll call, please.
Sabers. Rice. Dosher. Dosher. McCardle.
Here.
Whoa.
Barrington.
Here.
Allen.
Here.
Chark. Here. Smith.
Here.
Okay, we have a quorum. We're going to start off with COVID update impacts by Dr. Rockwell from Queen of Peace.
All right. Thank you for having me and for putting me first on the agenda tonight. So our numbers, our hospital inpatient COVID numbers have been down in the 8 to 10 range most days, which is a big improvement over October, November, when we were up over 20 on a daily basis. So we started inpatient surgeries again. Our staff, who had been working overtime and were exhausted, have been able to take a breath. So things are delicately stable at the moment. What we've been doing has been working to help mitigate. We are coming up to a higher risk time. As is Thanksgiving, I encourage people not to gather in large groups, stay home when sick, wear a mask, wash hands and surfaces. Concerns that January could certainly be another month where we see a spike in cases with holidays and gatherings and everything that I know we all want to do. As it stands, when you look at the numbers, at best, 20% of our county has had COVID. A little over 13% by actual test numbers. So a very generous estimate would be 20%. That means 80% have not, and I'd like to see it stay that way. With 20%, look what that did to our community. We've had over 50 deaths, hospital on the brink of being overwhelmed, our healthcare workers exhausted. The numbers do not have to go up if we do the right thing. We are not helpless in this situation or against this virus. The vaccine is almost here. In fact, it'll be at the hospital tomorrow for us to get things started. The path out of this pandemic is laid out in front of us, but we have to stay the course. We have to continue doing what we've been doing. It's clearly, you can see the graph, we've gone down, we're staying down right now. This is good, this is what we need. Stopping any of our mitigation right now would be the equivalent to, say you've got cancer and you go to your oncologist and he says, hey, looks like chemotherapy is working, things are stable, you're tolerating it well, let's just stop and see what happens. I mean, that's what it would be like. That would be ridiculous. If we back off anything right now, it's the same thing. We let this get out of control again. There's still plenty of people in our community that have not been infected. I know, much like our pastor said, this is not what you planned for when you ran for city council. We're going to fix up the lake. We're going to fix the, do good things around the community. You all had a common goal that we're going to make this community better. We have a common goal too. We want our community to stay healthy. We want our economy to stay strong. We want our businesses open and our kids in school. The mandate simply sets the expectation for everyone, and it just gives clear guidance. It moves us towards our common goal. We have to continue our commitment to each other to take care of one another and stop the spread with masks, distancing, staying home when sick, washing hands, and when it's available, get vaccinated. We hear over and over, let's go back. Let's get back to last year. Let's get back to the way things were. And we're not going back. We're going forward. And everyone's lives have been changed this past year. Some have been changed because they lost loved ones or they're dealing with a prolonged illness or prolonged recovery. 1 in 3 people are going to have a difficult recovery if they survive COVID. We've gained things too. We've gained time with our kids. We've gained appreciation for our co-workers and staff, our healthcare workers, our community members and small business owners for the job you have to do. We're going forward, and the path out of this is to continue what we're doing and the vaccine. Queen of Peace is expecting 800 doses of the Moderna vaccine this week. We have set up vaccination clinics for our healthcare workers, EMS, local and regional nursing home, and assisted living staff. This is exciting. This is a good time in this whole year. Long-term care facilities will start to get vaccine next week through our pharmacies. At this time, our clinics are going to be set up at the hospital as we move to different groups, and we'll start collaborating with county health nurse, with the universities, with our physicians and clinics to get the word out and get people vaccinated. Now, I was asked what metric we should use to stop our mitigation efforts and to stop the spread of COVID. And quite frankly, we need 60 to 70% of our population to get vaccinated. Otherwise, we're going to see that curve go right back up. It's going to take months to do this. The Moderna and Pfizer vaccine, which are the two that have emergency use authorization right now, are both 2-shot series. Moderna, which we'll be getting here, is on day 1 and 28. The first dose will give you about a 50% immunity. It's sort of a priming dose. The second dose bumps it up over 95%. So we have to get those 2 doses on board of the majority of the population before we get this under control. So there is still, we still got time. It's still going to take time, but it is how we get forward. And it's exciting that it's here and that we have this path out of COVID. I realize the mask mandate will run out in the middle of January if it's continued tonight. I can tell you with 100% certainty that COVID will not be gone in the middle of January. It probably won't be gone in the middle of February. It's been a long year, and we're maybe getting into the 4th quarter now, and we have to continue to work hard to take care of each other and realize that it is not going to be gone just like that. Even when we get 800 people vaccinated, hopefully this week, that's a drop in the bucket. It's still going to take time. But it's reassuring, and it's good that things have gone down and they've gotten more stable. The hospital, has had some relief. We're able to get back to some of our normal functioning, like surgeries. There are better things to come. Now's not the time to back off. It's the time to be more vigilant and to take care of each other. So our end goal, the one that we all have, is to keep the community healthy and get through this. Questions anyone has?
Yeah, I've got one, and you mentioned it. Can you tell me what metric Avera used in order to start surgeries again?
Ours was the ability. We never stopped doing all the elective surgeries. We backed off of anything that was inpatient when our COVID units were essentially full, and we didn't have enough. Our nursing staff was already at max. We also had to pull back some of our OR nurses to work on the floor. So as our nursing staff, we had enough nursing staff to cover the floor, send our OR nurses back to the OR, and it felt like we had a little bit of room to be able to keep patients overnight. We went back to our doing total joints and things that, surgeries that patients are going to stay overnight. So it wasn't exactly this percent or that number. It's more, everything's very fluid. It's how much staff do we have, how many are, it's still an in and out of people that are sick with COVID or exposed to for our staff, although it's much better than it was. So very much a day-to-day look at things. We were going week to week, and this is the first full week I think we've had of surgeries in quite a while. Mm-hmm.
Anybody else? Thank you.
All right, thank you.
Okay, as requested, we're going to revisit or have the mask mandate resolution on here. Action to approve resolution R 2020-83, amending the termination date of the ordinance O 2020-13. There's probably people wishing to speak. You are limited to 3 minutes this time, so.
I want to make a motion that we table to January 18th.
Second.
Okay, we have a motion to table until the 18th, so the second meeting in January. Well, the 18th is a holiday, so the 19th.
To January 19th.
Okay. Okay, we have a motion and a second to table.
Question?
Go ahead.
So when we went into this in November, we said we were going to look at it every meeting. This would seem to be changing that, and I don't understand what the reasoning is for that.
That does change it.
Yeah, that was one thing I was going to ask. We talked about before, just doing every meeting to revisit it. Obviously, these numbers have been changing drastically, as we know, from day to day, from week to week, and I don't see any reason why we don't owe it to the public to revisit every meeting.
Right.
I don't know why we're.
I'm not saying I'm going to vote
Yep.
one way or the other on
Yep.
it. I just don't understand why we wouldn't talk about it on the floor.
Correct. We made a decision, obviously a month ago to revisit, like I said, every meeting in which we owe it to the public. I don't know why we're going back on our word again.
Are you amending the motion then?
That would be for
Make it
him
back,
to
I guess
amend.
we wouldn't need to.
That'd be for
He, Mr. Sabers would have to amend it.
motion a second on the floor.
I mean, I don't have a problem, I guess I don't have a problem revisiting it.
Anybody in the audience wish to address this? Come on
I
up.
do have something I'd like to say first, if you'll indulge me, please.
Go ahead.
So I passed out a copy of this chart to all the members of the council, but I wanted to make sure that the public, I don't know if you can see this. I feel like this is such a great graphic and a great visual of what has happened in our community since we implemented the mask mandate. If you look here at 11/18, we had, the mayor implemented the emergency ordinance on the 17th, and on the 18th, our cases peaked. That particular day, we had 858 active cases. On the 18th, we had 882 active cases with 62 new cases that day. Through that week, we were having I'll give you some numbers, 838, 821, 858, 882, 800, a few 700s on either side of that period of time. And then we implemented the mask mandate, and we had a little bit of a slower decline, and then all of a sudden our cases started to drop. And I feel like this is just such a powerful representation of the good that has been done with the mask mandate. I looked tonight to see, first of all, I want to tell you the best news of all, in my opinion. One of the exciting things today was that when I looked at the cases that came out, we have gone from a high on the 18th of 882 active cases to today we have 148. active cases, and today we only had one new case, which I don't think we've had one new case for a really long time. So I think that's, just really wonderful news. So before I came tonight, I looked up and I looked at what the mortality rate for the virus is, and it is right now in the United States 1.8%. So one for every 100 active cases, 1.8. We can assume that 1.8 lives would be lost. We have dropped 734 cases, which equates to 13 lives that have been saved just because we reduced the number of active cases. Now, had we not implemented the mask mandate, it's hard to say what those numbers would look like. It's hard to know what our average cases would have been. So, if we get technical about it, I think probably there have been more lives saved than the 13. But in my mind, I'm like, 13 lives in Davison County is a powerful number. That's a tremendous number. And that comes from Bonnie Specker, who's the epidemiologist at South Dakota State. So to me, I feel like that number is the thing that makes me wake up in the morning and go, is this a fight worth fighting? Because trust me when I say, I have my doubts, but we all have to decide who we're going to trust to get our information from. And in my life, I have a husband who's a physician. I have a son who's a pathologist. I've listened to the local hospital. I've listened to Dr. Rockwell. I've listened to Dr. Margallo, the nurses, the other physicians, Rochelle Ryder, and administration. And I've looked at the data. And for me, you can say what you want to me personally, but I have to tell you that in my defense, there is no ulterior motive in this for me. I have nothing to gain by promoting that we wear a mask except the health and welfare of the people of this community. And trust me, let me just let me be clear. If there were a way for me to back out now with a good conscience about it, oh my gosh, hands down. I'm not up to the task. Sometimes I think, yeah, I need to get some thicker skin or something, but the fight, it's not a fight that I want. I don't like wearing them either. I've got nothing to gain except that I feel like I took an oath of office that I would do my best to do what needed to be done that I feel like is in the best interest of this community. And this mask mandate, in my humble opinion, is the very best thing. And I know that I touch my mask. I know that I do. But I still think I'm doing the best I can. So do the best I can. So anyway, just wanted to say those things, just let you know that my intentions are pure. I'm not a malicious person. And I really do care about people. I care about this community a lot. So I just want to say that. Sorry.
Finished? Okay, thank you.
You gotten the death threats too? Probably pretty sickening, isn't it?
Dwight Stadler, 700 West 7th Avenue, Ward 4. I appreciate your emotional plea in this, Councilor Jarks. I don't know, can you pause the time because I got a question on this. Are we discussing the tabling of this or actually discussing the mandate? Because I started out talking about
Let's do this. Let's vote on the tabling of it and see where that goes before you start talking. We'll start your 3 minutes over.
Yeah,
okay.
I just want to address the tabling.
And if nothing else, we can turn this into public commentary on it if we have to. So, okay. All right. So hang on just a minute.
So my question is, will we be tabling it to?
The motion is to table it to the 19th of January. Okay, that's your motion. It's not been amended.
Right. So do we need
So the discussion amongst council was we had said we were going to do it every 2 weeks, and this changes that. So your vote is whether or not we're going to table this until the 19th. Okay?
Didn't we, My question to you, Mayor, is, was it 2 weeks ago we tabled this?
Yes, because you've asked for it to come to every meeting until it sunsets.
I see.
So, that's why it's on every agenda.
Okay.
That was the request of council. So, roll call vote on this, please. Oh, okay.
Dan, with that coming to light, you still want to give it a meeting? And why the 19th versus what's the next meeting, 4th?
The 4th. That's just his preference.
Does the public want to say in this, on the tabling? Because I got a comment I want to make on that. I would appreciate it. I mean, you can table this,
Well,
table it, and all you're doing is extending the mandate, and we never have an opportunity.
The mandate right now sunsets the 22nd?
It's like a delay tactic.
Well, it does, true.
Yeah, a motion and a second, then there's room for discussion, I guess, on the table.
We can still have a discussion, right?
We can.
On the table.
You can discuss the tabling of it right now if you want.
Yep, just the table.
Yeah, I just said it. I mean, you're going to keep tabling this thing. It's going to go on forever, and the public's never.
Well, it will go on until the 22nd or whatever it is. Yeah,
Yeah,
60
another
days.
60 days. What happens then? You're going to table it again for another time?
No,
I'm
it sunsets
infuriated
unless
with this, because you tabled it last time,
the
and now we're here, and you're going to table it again.
the
And by the
22nd.
time
It
we
will,
get done, vaccinations will have been done, COVID will be on the downswing to the point where it's a moot point.
they can't table it on the before the 22nd, or it sunsets on the 22nd. It'll be gone.
Done.
Maybe
If we don't extend it on the 19th, or tonight, or on the 4th, then it sunsets on the 22nd of
I
January.
get the sunset part. What I'm frustrated with is the tabling of it.
the
Because
tabling,
you table it, we don't get to address the mask mandate issue. Am I off track? Am I misunderstanding?
We had testimony last meeting. I believe you decided to leave, and that was your prerogative, but we did have people stand up and
I testified last time, I got stuff to testify to this time, and new stuff to mention.
I don't know
as
why
well.
we wouldn't listen to it.
Maybe just for clarification, the only thing that the resolution does is it makes the date earlier than November 23rd, and that's how the ordinance was set up. So the resolution can't extend it, or excuse me, January, yeah. It can't extend it past the original sunset set date.
So the resolution, you can change the date to whatever date you want it to. So you can extend it or you can shorten it.
So also, Dwight, what we're talking about is we were going to discuss at every meeting. There's a motion on the table or to skip one meeting. We're going to vote on that, but then there's also the original is on the docket for discussion. So as far as getting rid of the mandate, it's still on the agenda. So there was a new proposal that was brought forth of not discussing it next meeting. That's all we're discussing right now. But we will have.
But if that passes, then we're basically done with this issue tonight and until the 19th, correct?
Correct.
So to his point, he would like to have a discussion or to bring up some points. Come on,
Have a discussion.
give us what you got. You got 3 minutes.
Okay.
Start his time over, please.
Okay. So I heard some impressive sounding numbers tonight. What I did not hear was any data analysis correlating mask mandate to the reduction in COVID cases. There is no data analysis. You got a lot of raw numbers that you've heard from Dr. Rockwell, but you have, and same thing with you, Councilor Jarks, a lot of raw numbers, but no data analysis to make a correlation between the mask mandate and the decline in it. With that in mind, there's a new study that was out by rationalground.com, consisted of data analysts, computer scientists, excuse me, and actuaries. And they did a data analysis of all 50 states conducted from May the 1st to December the 15th. That was 229 days. And they were examining the results between states with no mask mandates and those with mask mandates. The number of COVID cases per day, per 100,000 people in states with mandates was 27. The number of COVID cases per day per 100,000 people in states without mandates, 17. I said in the beginning, these masks do not protect you against airborne pathogens. And I don't think there's a physician that would deny that if they've had proper infection control and infection prevention training. And by the way, have you noticed that CDC isn't publishing any flu stats? How many of the cases that are in the hospital? How about the unreliability of COVID testing? Elon Musk, CEO of Tesla, got cold symptoms. He went and got tested, did 4 tests from same person, same process. 2 came back positive, 2 came back negative. It's unreliable. There's countless cases of that. There's also where COVID cases, if somebody's had COVID cases in the last 30 days, their death, even though it's unrelated, as a gunshot wound in Colorado is an extreme example, gunshot wound, but the guy had COVID case earlier, so they labeled it as a COVID death. So you don't have reliable data. You don't have any data analysis to back you up on a mask mandate. There's nothing out there to do that. The quarantine regarding here, the quarantine period is 14 days. By the time you got through this process and you decided to do a mask mandate, the COVID cases had already peaked, I submit, and you were already headed for your downward trend. And regarding CNN, MSNBC, and the Washington Post, they were after Kristi Noem. They made you a martyr, Counselor Jarts, but they were after Kristi Noem. That's the bottom line out of that. And they did not mention your situation where you were unmasked and not social distancing as well, and they should have. But that's the liberal media. Thank you. I apologize for going over.
Thank you. Anybody else wish to address this?
I've gotten a couple comments that it's hard to hear council on your microphones. I had to turn it down because of the reverberation, so just make sure that you're getting close to the microphone.
Okay.
Hi, Sonia Van Erdwick, Mitchell Township. On November 17th, the mayor called for the citywide mask mandate, at which time there were 15 total deaths in Davidson County since the start of the pandemic. Positive cases were already peaking, as he had just noted, and the normal trend of all viruses of their course is to be declining, which is what happened. On November 25th, the death rate rose to 30. By December 16th, almost a month since the mask mandate, the death rate rose to 52. So consider this. If masks work, why have we seen a 350% increase in deaths since the mask mandate of November 17th was instituted? Let's consider that many of these deaths are happening in the nursing homes. In those nursing homes, however, all the staff have been wearing masks this whole time. No visitors are allowed in, and the residents are isolated to their rooms, leading to loneliness and despair, yet so many of them have died. Well, sounds like to me that the masks don't work to stop the spread, because if the staff are wearing N95s and face shields, which they are, how can we even say that a simple cloth mask can make a bit of a difference? If every life counts, which it does, I challenge you to give me a reason why these residents are dying. We already have scientific studies that show a little piece of cloth doesn't work to stop the transmission of viruses. There have been 12 randomized controlled trials from influenza and other viruses, respiratory viruses, that showed that there was no added benefit for mask use. In fact, the recent Danish study of 4,862 people, which is the first of its kind of a randomized controlled study in a real-world efficacy against coronavirus, shown that it made no statistically significant benefit of wearing the mask. So I ask you, where is your randomized controlled study proving that masks work? There isn't one. We can't simply say that they work just because it sounds good and that we have some low-level observational study and deny the fact that public health officials have never recommended healthy people to wear masks. We need to be asking the question, how can we now say that they do work and ignore all the factors that affect our health? What we have really done is tried to simplify our immune system health to wearing a mask and that it will protect us from getting sick and ultimately show that we care more because we wear one. I ask all of you, how does it show that you care when you only look at one possible solution to mitigating health and deaths in our community? If your doctor only looked at one facet of your health, would you be happy with that, or would you hope that he or she would consider all options in your differential diagnosis? Are we now to believe that there is a one-size-fits-all approach to health care? If it is, we have lost all humanity and love and respect for the individual and individual health freedom. Where there is risk in any health intervention, there must be choice. And those of you who supported this mask mandate disregarded the God-given individuality and right to breathe as God intended.
We have the right to life, liberty, and the pursuit of happiness. And the last time I checked, that did not include any overreaching council or government deciding what is best for my health. So I plead for you, I know you guys have a difficult job, but that you can show whatever graphs you want. But studies talk, real randomized controlled studies talk. Thank you. Appreciate your time.
Thank you.
I'm just going to interject that I did just forward to all of the council the Mayo Clinic study that was released that did endorse masks and said that they are effective in preventing the spread of the virus.
Justin Luther. First of all, I don't envy any of you. I know how polarizing. I don't envy any of you. I know how polarizing this is and how difficult it is. What I can say is there's studies out there both ways, and there's numbers being thrown out by both sides. My gut feeling is that somewhere in the middle lies the answer. As far as your rights and liberties, we wear seatbelts. We have alcohol laws. We have tobacco laws to protect people from themselves. And I think at the end of the day, as leaders of people, as difficult it is, sometimes we have to make decisions that aren't popular, that aren't fun, and we make decisions that protect people from themselves. I don't know. If it's 25%, it's enough for me. If it's 50%, anything to do to help. And I will tell you this, and trust me, I get both sides. I hate this thing. Everybody hates this thing. But if I could save one person, and maybe it doesn't, but I feel like if we all try to do our part, we'll be better off. And at the end of the day, I will say our staff feels much more comfortable working every day, whether they believe it or not. And trust me, when this first started, when we put our mask mandate in our stores, it wasn't fun. It was just this same thing. And we still have some people that way. But at the end of the day, I can tell you whether it's because of incubation period, whether it's because of how it runs the course, our number of cases and quarantines in our stores are way down. Now, I'm not a scientist. I know there's a lot of people at the CDC and World Health Organization, a lot smarter than I am, that do recommend these things. And at the end of the day, that's what I go off of. And again, I know it's not fun, and I know everybody has their right to their thoughts and their opinions, but at the end of the day, we do put laws in place to protect people, and that's their given right. They want to smoke, they can smoke, but they can't do it before they're 18. They want to drink, they can, but they can't do it until they're 21. We do these things to protect people and people's health. We have to wear seatbelts. It's a law, So, again, thank you all for your hard work. I know it's hard. I know it's not fun. I'm sure you're getting a lot of phone calls. God bless you all.
Thank you.
Regardless of whether or not these masks work, the damage it does to our culture, it is not worth it. The lives that can be saved cannot be counted, okay? Of those 13, do you have a name? How about Spencer Smith, a 16-year-old kid that loved football, lost hope, and killed himself? Now, he's from Maine, so I guess we don't care about him. I bet you Mr. Timmer would have given his life for that kid to be able to play football and to live. Avera is expanding its ability to care for the influx of depressed kids. Just pump them full of antidepressants, anti-anxiety, antipsychotics, and they'll be all right, won't they? Drug overdoses are at an all-time high. San Francisco has 4 times more drug overdoses than COVID deaths. Don't we know what drugs do to our families, Susan and Dan? Don't we know what they do to us? I know very well what drugs do to my family and what it has done to my family. Now, I don't trust your science or your doctor. Look at what their prescriptions are doing to the world. In 2018, Johns Hopkins study said medical errors are the 3rd leading cause of death. 250,000 a year, as much as 440,000 people a year die from medical errors. After 9 months, masks still are best scientific answers. That is pathetic. Ivermectin, I heard a doctor say that if you take it, you will not get COVID, and if you get COVID and take it early, you're almost guaranteed not to die. Is that true? Is there other options, Dr. Sharks? A lady in Alaska had severe side effects from the vaccine. I guarantee you one person will die from that vaccine, but that's for the greater good, right? Now, Dr. Sharks looks like he's pregnant, okay? I'm not trying to judge here, but I don't trust him when it comes to telling me how to live a healthy, happy life, okay? I don't trust him. I don't trust you. I don't trust the media. I don't trust any of the propaganda. I do not trust your God science. I don't trust my government at any level. Who do you trust? I don't trust coaches. I don't trust churches. Catholics ruined that for us, haven't they? Now, would you trust a deacon in the Catholic Church alone with your children? I wouldn't, because we know better. Haven't we learned our lessons? The fact that Dr. Jill Graves, you see what I did there, is a deacon in the Catholic Church should be enough probable cause to go search his computer, especially the way he's screwing our kids, taking their memories, replacing them with nightmares. And have you seen the scar on these kids' faces right here from wearing these masks? My son has it. I will never forget this. Okay, one restaurant closure here in Mitchell is too many, but 110,000 of them have permanently closed in the United States, all right? People, these mask laws have consequences. People lose jobs, people lose hope, people lose dignity, people kill themselves all over the place, all right? Drug addiction shoots up, violent crime is everywhere. What happened last night in Mitchell? The shootout, did some kid shoot his parents? Was he high or drunk? What happened last? Oh, just another one, huh?
Mayor, if we could have people announce their names, I'm getting questions as to who spoke. That was
Okay.
just Reed Bender.
Anybody else?
Penny Overweg, and I had a message from Chris Nebelsick, and he wanted me to make a comment tonight. He wanted me to tell you that the choice to wear masks should be left up to the discretion of the business owners. For instance, this morning he had an appointment with his accountants who are older, and they asked him to wear a mask or not to come in. And he would do that out of respect for the business owner, and I would be more than willing to respect the individual businesses if I wasn't forced to do it everywhere. We should be willing to wear them where it makes sense, but have individual freedom on whether to use them in our businesses or other businesses or not. There are times it just does not make sense to wear a mask. Thank you.
Thank you. Anybody else?
Hello, my name is Carol Grody Hanks, and I would like to say thank you very much for all of the diligence that you've done to vet this mask mandate. I used to teach English, and in my classroom I had a poster hanging proudly on my wall that said, "What is popular is not always right, and what is right is not always popular." And it's very hard to proceed sometimes when you have two sides to every story, and that is true in anything that we do in life. There's always two sides. As leaders, it's our responsibility to listen to the experts. When I have a problem in my house, if the floor is warped or something, I call the construction person to fix my floor. If my heating goes out, I call the AC vac person to come and fix my AC heating cooling system. And the same thing holds true with the mask mandate. We need to listen to the medical professionals and continue on the process and going forward instead of going backwards. Just as we've heard tonight, we are never going to agree. That's just going to be the bottom line. But what we do have is a responsibility to the 15,000 citizens of Mitchell. And that responsibility isn't always what we want. Like everybody has said, I'm not a big fan of the mask either. I don't like to wear them, but I do know they work. Just from my experience and being in close contact with people that have had masks on, and I've had a mask, and we wash our hands, it's right. It is a whole unity approach to the issue. It's not just the mask. It's not just washing the hands. It's not just the 6 feet social distancing. It is all of that combined. And so I do want to say that I appreciate you taking a look at the situation all the time. I don't know if it's necessary to revisit it every single council meeting, because what you will have is the same thing every single council meeting. These people say this, these people say that, and we just have to bridge that together. That's the hard part. So good luck with that, and thank you.
Thank you.
Greenway Corn Palace. I just wanted to mention, as you hear the basketball bouncing upstairs, we're coming into full-fledged basketball tournament season, and we're very fortunate that people want to come to Mitchell. South Dakota's been fairly open, but I had a discussion today with tournament organizer for January 30th, which will bring 9 games to the Corn Palace, and another one on December 30th, another one on January 2nd, another 9 games, and neither one would be comfortable bringing the tournaments here if we did not have the mask mandate in place. In fact, they would not have those tournaments. So they're very appreciative. It makes their job easier to encourage people to come. And I will tell you that both of them are only doing that because they want kids to be able to compete, and they want their parents and grandparents to be able to see them during their senior year in most cases, because this is their last chance. And so there's a large volume of people that will want to do that, and they only get that opportunity if the mask mandate stays in place. And as a facility, if it goes away, we would probably still enforce it at the Corn Palace, because we would not be able to hold events, and as you know, bringing a large number of people into a smaller environment is not safe unless we have some protection. So, and that's a real economic tool for the city of Mitchell, and all the businesses that want these people to come. This will affect them if we don't have those events, and then we're having them because we can wear masks.
And Doug, just to echo back on that, that goes back to our original ordinance that we had in place about considering what we want to do for city mandated facilities. And I don't disagree with your thought on that, but what I'm trying to get at is the fact that that goes back to what we were all about here to begin with, and we got changed the Blue 40 option on that night when it went to a city mandate, when it was all about city facilities only. That was a whole different ballgame. That's something that we can definitely reiterate if we want to as a city, for city facilities, but I'm talking about citywide is where our concerns at.
And the Corn Palace could implement something for each individual tournament, much like the
Correct.
users already do. Dakota Wesleyan and Mitchell High School both allow so many people in their games. So.
Yep, and I think that would be something we'd consider. I mean, we all know we don't want to lose any basketball games. And if they want to say that to us, we'll come, only if you have a mask mandate within the facility. I don't think it takes a genius to figure out what we're going to do. We're probably going to do a mask mandate for that tournament. So.
Anybody else? Okay, we have a motion to table until the 19th at this time versus having it every 2 weeks as the council had originally asked. So that is the motion. We have a second. Motion by Mr. Saber, second by Mrs. Charks. Roll call vote, please.
Can I ask a question? Just hypothetically speaking, were this to not pass, can we then do a second?
Mm-hmm.
Okay, just curious.
Dosher. McCardle.
Aye.
Barrington.
This is the table till the 19th?
Yeah, so if you vote yes, you're tabling it till the 19th,
No.
rather than 2 weeks.
No.
Allen.
Aye.
Chark. Aye. Smith.
Nay?
Sabers.
Aye.
Rice.
No.
5-3, motion carries. So it's tabled until the 19th.
So I want to just say one thing, since we're not going to move into another item on this on the agenda. You know, Susan's handed out this report here in this chart, and it looks fantastic. And we all need to be happy that the numbers are going down, obviously. But listed on here are several counties that they're following. Not all the counties had mask mandates. And I think you can see where every county was spiking about the same time, which means the state was spiking at the same time. Some had mask mandates, some did not. And then what you see then is everybody coming down at the same time, with mask mandates and without. So what we're doing as a state is working with or without masks. We're staying home when we're sick, we're staying apart from each other, we're probably lessening our groups that we're in. That is what's really happening to the state of South Dakota. And again, you can say, well, the masks do work or don't work, but we need to continue to do what we're doing right now with or without the mask.
Okay, thank you. Okay, we done commenting on that? Okay, citizens input. If you need to address the mayor, members of the city council on an item that was not on the agenda, excluding personnel items, please come forward to the podium, state your name and your concern. Presentations are limited to 3 minutes. Items will be considered, but no action will be taken this time. Does anybody wish to address the council? Mr. Bender, state your name, please.
Reed Bender. was wondering what the numbers are at the rec center, because I go there a lot and I've seen a lot of names tags getting taken off the lockers, just because I'm sure a lot of people aren't using it. I don't see as many people there, you know. I used to know some nurses there that used to go, they're not going, I'm sure they're.
You want to know membership numbers?
I do have a membership there, yeah, and I use that a lot, so.
No,
I was just
but
wondering
what numbers do you want to know?
Like, as far as membership numbers and stuff like that, if it's going, membership is going up or down, or how that is, because I think that's a big part of the health of our community, honestly.
Yes, I don't have that,
55,000 square foot.
and
At some point, maybe we can get some of that. And then there's a light at Spruce and Highway 37 out there by Walmart. Can we get that changed?
that's a DOT light, I'm sorry.
Can we talk to somebody about it?
You'd have to go through DOT for that. Believe me, I'm trying to fix all the lights in this city. I don't like them.
I gotta go around with my big trucks.
Mr. Croce's going to speak to that for you.
You are?
We're talking about the light at, sorry, Public Works Director Kyle Croce. So it's the double left turn, or it's a single left turn right now. So we're in the process of working out a program on widening Spruce on the east side of the intersection there. When we're able to widen that, and we have part of that project next year, scheduled for next year, when we can widen that so the taper goes down to a single lane on the east side, we'll be able to have a double yellow turn, left turn lane, and then that'll help quite a bit.
That stoplight is Mr. Croce, that stoplight is actually DOT's, correct?
It is. The timing on it is DOT's. We've talked to them a number of times and explained, what the issue is, but until we get that changed, they really won't revisit it.
Believe me, I harp on Mr. Croce almost every week about stoplights in this city. I'm trying to get something done. Bear with us. Oh, all right.
Thank you.
All right. Hey, Mr. Croce? Is Mr. Powell standing out there somewhere? Have him come in here, would you please? Mr. Powell, there was a question about membership at the rec center. Do you know where you're at number-wise, or?
Yeah, we've been sticking around 80%. We dropped a little bit when the spike came up to about 65% from last year.
Okay.
So I haven't seen, since it's gone down, if we've gone back up or not, but last I looked, we were at 65% capacity from last year.
Does that answer your question, Mr. Bender?
Is that membership or usage, Nathan?
That's check-ins, I'm sorry, check-ins.
Check-ins are about 65% of what they were last year. Membership's about 80% of last year?
No.
All check-ins.
It's all check-ins.
We
Okay,
were
my
at
mistake.
80% of capacity from last year, and then it went down when the community spiked to
Okay, got it.
65%.
65, that's
Just
the last
making
time
sure
I
we all
checked. I
understand.
haven't checked
Okay.
since.
Trying to help your voice, Nate.
Thank you. Okay. Anybody else wish to address council? Okay. Approval of consent agenda items. Items appearing on a consent agenda may be removed by a council member for discussion at the beginning of formal agenda items. Is there anything you wish to remove?
Move to approve.
Okay, we have a motion to approve by Mr. Allen.
Second.
Second by Mr. McCardle. Further discussion?
One comment, and good news, and we're looking for it. So within the consent agenda is the approval of our health insurance stuff. And I was on the council in 2014 when our insurance numbers of what we had in the bank were terrible, and we had to make adjustments. And now the numbers look actually really good, and can even consider what we're going to do in 2021 and 2022. So I just wanted to point out that actually it's probably a thank you to the employees of the city of Mitchell trying to improve health and be healthy, and it does eventually, might take several years, but does help our self-funded insurance. So the promotion of the rec center and the use for our employees and everything else, I don't think can be overstated. So I just wanted to point that out.
Okay. Anything else? Roll call vote, please.
Barrington,
Aye.
Allen,
Aye.
Chark. Aye. Smith,
Aye.
Sabers,
Aye.
Rice,
Aye.
Dosher, McCardle.
Aye.
Motion carries. Action to approve the 2021-2022 Clubhouse Manager Agreement. Mr. Powell, or who's going to, Mr. Ganeri? Okay.
Jason Ganeri, Gulf Cemetery Department. Here to request approval for clubhouse manager agreement for... Oh, sorry, Jason Ganeri, Gulf Cemetery. Here to request the approval for the clubhouse manager agreement for the year 21-22. It has a 3% increase from the previous 19 and 20 years. Very few changes in it, just some grammatical and
This maintains Mr. Heeb, correct?
Yep, Mr. Heeb. It was approved by the board as well. Yes, yes. The board approved it also.
Okay.
Well, he does a pretty decent job out there.
Great.
He does a great job out there. Motion to approve.
Second.
Motion by Mr. Barrington, second by Mr. Rice. Further discussion?
I'd just add one thing, Mayor. You're voting later on the creation of the Golf and Cemetery Board, so the reason that you're hearing this instead of them is that the agreement would need to be in place before the end of the year, and the board would not go into place before the end of the year because you're just creating it tonight. So.
Okay.
Yeah, you have second reading and adoption tonight of the board, so. Okay, further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried.
Thank you.
Thank you, Mr. Canary. Action to approve counseling services for preliminary conceptual design for Fire Steel Park Post dredging. Mr. Croce.
Mr. Mayor and Council, Kyle Croce, Public Works Director. So I wanted to give a little bit of background on this agenda item. Currently, we've had, or just recently, we've had 5 companies respond to our SOI, and that was for dredging services. 3 were selected to perform presentations, and we will hold those presentations after the first of the year. Also, I got in contact with Ducks Unlimited for the design of the watershed low-rise dam upstream, and they've provided a proposal, and James River Water Development District is offering to help us, help fund the design as well. So those are 2 good items that we have moving forward. Right now, we're talking about dredging and the spoil site, and discussing through the contractors or consultants, we really noticed that one of the areas is a prime site for dredge spoil site, and that is the Fire Steel Park on the north, I guess, northwest side or southwest side of the lake there. It's a 43-acre parcel. The idea would be to clear that area of what's there existing, and then eventually, after the dredge spoil site is established, a recreation area would be developed, and there would be recreational items that Nate can discuss, possible sledding hill, other bikes and trails, park shelter areas. So we reached out to Confluence over in Sioux Falls, and they provided a proposal to give us a 2-dimensional, maybe 3-dimensional, of a concept of what that is going to look like in the future, what the end product would be, and they've provided the proposal for the amount of, I believe it is $10,250, and staff recommends approval of that.
I'd like to move approval.
Okay, motion by Mrs. Charks.
Second.
Second by, is that you? Okay, Mr. Allen, thank you. Second by Mr. Allen. Further discussion? Anybody in the audience wish to address this? Okay. All the,
Oh, there is.
Good evening. My name is Joe Kippis with Friends of the Fire Steel. We've been working on the in-lake solution for some time, and of course that amounts to dredging. And probably a significant issue relating to cost is having to transport spoils. So if we cannot find reasonable spoil locations close to the lake, then we pay for this. It's really a large number. I wish I could tell you exactly what it is, but if it's a million cubic yards of consolidated sediment, and a semi is roughly 15 yards, 18 yards, I'm not sure.
Something like.
Then you get an idea
Close
of
enough.
how many semi-loads. So when you start considering transportation, if you got to go 3-4 miles, then now you're racking up a lot of dollars. This site, I think, is ideal in that it cuts down our cost dramatically, and then in the end, the idea of creating a park, a recreation area, really creates a situation where we can save some money, and then in the end, people can use it. It's pretty much a win-win deal, in my estimation. So just so you know, Friends of the Fire still supports this strongly.
Okay, thank you.
I'm just wondering if, for the public's information, if you'd like to discuss how we're going to prevent any of those phosphates that we're dredging up from leaching back into the lake. I think that's an important component of this.
So what I'd like to do is get the information from the consultant, but there are a number of different ways we could go about it, whether or not it's hydraulic dredging or mechanical dredging, and then there's a system of layers that we could also use, clay layers we could use to cap it so that there isn't any leaching back in, but we will rely heavily on the consultant for the information.
Okay, anything else? Mr. Paul?
I can just comment on the master plan as well. We're working on that with NDSU. This particular Fire Steel Park area was not part of the scope of that project, but we are completing that. COVID kind of put it on hold for a little while, but I've been reconnected with NDSU. They've got a team of 3 right now working on it. We're hoping to present that to the Parks and Recreation Board next month, and this will actually complete the overall master plan that we set out to do a couple of years ago. So this is kind of the last piece. There's no more planning for recreation after that, so this will complete that part of it.
Thank you. Anything else? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carries. Action approved Mitchell Regional Airport updated hangar lease. Mr. Croce.
Mr. Mayor and Council, so this is an updated hangar lease agreement that Mike and Justin put together. It does include some compliance with federal, state, and local laws for construction, and this would be for new transfers of ownership for hangars or new agreements for newly constructed hangars.
Just one question, reading through it again. It talks about leasing and subleasing. Do we have people that have hangars that then sublease? And
right now, we just have leasing.
Leasing, so, okay. But it's allowable for them to do that if they meet the requirement?
Yes, and we would be involved with that sublease as well.
Motion to approve.
Motion by Mr. McCardle, second by Mr. Savers. Further discussion? Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve permanent easements for the South Dakota Highway 37 and Minnesota Street Light Project.
Mr. Mayor and Council, so this is for easements on the northwest side and the southeast side. Those corners need permanent easements for lighting, for street lighting while you're approaching the intersection, and the property owners have agreed to those permanent easements.
Are we due to get street lights or stoplights in this area too?
That is.
Is this a precursor to the state?
So the state is under design,
Yep.
and
That was my question.
they're estimating a completion of next summer, completion of the intersection with stoplights and streetlights.
With stop. I think a lot of people work at Innovative and Vantage Point will be happy with the stoplights ultimately, because it's hard than heck to get out of there during the hours. But make sure the timing of the stoplight.
That's what I,
Have as much input as you can.
and I
in
guess
that,
that's a
please.
question, because the state DOT says they're putting engineering controls in, which in their vernacular is stoplights, but that doesn't mean it's always green and always red, or that the timing is whatever it might be, like as cars might be lined up on Minnesota, approach lights would flash
Right.
and then tell you you have to stop coming up
Right.
when
And
you're on the bypass?
that's correct. And actually, this is a discussion we had last year with the DOT on actually the camera system. So not wiring loop. They'd all be camera detected for control of that. And
Okay.
so
So engineering controls
Yes.
that
Right.
will
Yes.
result with lights there, but how the lights operate will depend on traffic.
that's
Much better than the rest of the city, I hope.
Time will tell.
Yes. It'll be much like if you drive through on 169 through Mankato, you know, they tell you, hey, you be prepared to stop. You're going to hit a stoplight up here. So, okay? All right. Very good. Anything else? Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve permanent, whoops, wrong one. Action to approve, yes. Action to approve agreement A20-2048 for design and construction services with Bros Engineering for West Harmon Utility Improvements Project 2021-16.
Mr. Mayor and Council, so this is a project for 2021. We have extension of the water loop on West Harmon. Right now it terminates, I believe it's at 29 West Harmon, and we're trying to extend both the water and the sewer system. Both, yes, sir. We feel that this is a portion of what was extending for the master plan for the water system, and gives us the capability to attach for sanitary sewer for those who are on septic right now. So this is part of our master plan on our water and sewer, and we recommend approval.
Question, so the idea, hopefully, and I don't know if sewer will go all the way around, but water go all the way around so we don't have dead-end loops at the
That's correct,
lake?
yes, sir.
Okay.
The sewer would probably terminate at the West End Bridge. We wouldn't need it because it's already, there's a lift station on the island already. So we wouldn't need to loop that system, not an issue, but the water, ideally, we would want a loop system around,
Okay, Mr.
around the lake.
Croce, let me stop you for a second. I goofed. We did not have a motion and a second on the previous item. That's what threw me off. We got off on the stoplight discussion and we skipped it. We all voted, but nobody had a motion and a second, so. Okay, we have a motion by Mr. Saber, second by Mr. McCardle. Now, any further discussion on that one? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. All right, now continue on with this utilities on Harmon. I apologize, that was my mistake.
Move to approve.
Second.
I didn't mean to throw you all off. Motion by Mr. Barrington, second by Mr. Wright. I didn't mean to throw you all off.
Question, Mr. Mayor.
Yes.
With the issues that we have out in the area as far as some sewer and the backup, is this going to reach out to any of those areas that we've had some issues in the past, or is that a different fix that would be on the other side of the lake?
So I haven't seen or heard of too many issues in this area for sewer. It would be some of the issues that we did have backups, particularly during the storm events, were further to the east and South Harmon, but not this area. This would be extending the existing main. So and with the potential for people that have septic tanks to be able to connect to our system. And we do have issues on the north side around the island and north in that area, and that was the reason for the Daily Drive lift station project.
Okay, further discussion? Is there anybody in the audience who wishes to address this? I think we lost most of our audience now, huh? Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve agreement A/2020-49 for Mitchell Shoreline Restoration Wetland Delineation with Lund Engineering and Environmental LLC. Mr. Croce, good luck explaining this one.
Mr. Mayor and Council, so this is a requirement from the U.S. Army Corps of Engineers. Initially, we did not anticipate that we would need to delineate the area that we see that doesn't have wetland right now, and we're creating a wetland. So, but we did reach out, or our consultant did reach out to the Army Corps. This is a requirement for permitting, so we need to have these services done as part of the project to move into construction.
This where you put the cattails back in?
This is where we would put cattails in on the west side of, or southwest side of the bridge, the West End Bridge.
So it's in reference to us doing the upstream wetland project?
No,
There was a project that we had Bros Engineering do a design for shoreline restoration on the lake section.
Right.
Yeah.
Oh, and that requires...
From the West End Bridge to the east a little ways?
That requires a wetland...
Yeah, go figure. We're creating a wetland. They want a wetland delineation of what's existing wetland.
Only in the government.
Government red tape is what it amounts
Only
to.
in the government.
Hey, careful, you're government here.
I know. But
Mayor and council, we do need to clarify one item on the staff report. It says that it's coming out of general fund assigned cash. We don't actually write checks out of general fund assigned cash, but what we would anticipate doing is transferring that whole $85,000 over to the water fund designated for the lake improvements so that they can use it as going forward. You have a previous agreement that you've already approved for $17,000.
I think it's 11 or
11,000. I can't remember. 11. I think the total was close to 17 with both of them. This one's like $4,500.
Yeah, 4,000. Yeah.
Yeah, 4,000. So the total will be about $17,000 coming out of that $85,000, but it's paid for out of the water fund lake account. So I just wanted to make sure everyone was aware of that because it's not a budgeted item.
And we talked to Lund, and they could actually schedule at the end of the month because good weather, so we wanted to get them moving forward.
Move approved 2020-49.
Second.
Motion by Mr. Rice, second by Mr. Allen. Further discussion? Is there anybody in the audience wishes to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve agreement A/2020-50 for West Harmon Drive Bridge wetland delineation with Lund Engineering.
So this is another wetland delineation that is required from the Corps, and this would be in conjunction with our extending the water and sewer utilities along that West Harmon. It's not the West End Bridge, but it is a bridge, considered a bridge at the starting point of our construction, extending it further west and north.
So what's the cost there?
That is $4,000 for Lund, not to exceed $4,000.
And for your information, the area just west of Porter's house is considered a bridge because of the span, so. Okay, because initially I was thinking it was the West End Bridge, but it isn't.
And these funds would come out of the Public Works Enterprise, water and sewer.
Move to approve.
Motion by Mr. Allen, second by Mr. Rice. Further discussion? Is there anybody out in the audience wants to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve resolution R/2020-82, resolution approving the 2021 compensation plan for the city of Mitchell. Ms. Elwine.
Included in your packet, I had the 2021 compensation plan. There was just a few changes from what you've seen in previous years. First of all, we did incorporate the approved reorganization of the Public Safety Department. I almost said Public Works. With the removal of the Public Safety Director, we added the Chief of Police and Chief of Fire. We also did just have a name change for the Golf Supervisor to the Golf Class A Superintendent. And then the other thing that would be different is we noted the number of full-time employees when there was more than one in a position after each position. In the part-time employees, same thing, we noted the department, the division, and then the number of budgeted employees, so you could see those as well. The pay plan includes a 3.25% increase to the ranges that was agreed to between the city and the three unions
during negotiations that occurred for a 3-year contract.
Do they have any leadway, like on a part-time help? If somebody's really qualified, but they're part-time, do they have a leadway in their salary? They have to go by this?
The part-time, we have had a structured part-time compensation plan for 3-4 years now. If they have an employee that comes back multiple years, they can hire them above step 1, so they might have a second-year employee comes in at step 2 or a third.
No, more like, you got your guys, let's just take the golf course, just say you have a part-time guy that's a really good mechanic. Do they have a leadway to get him more money?
You really can't do that, or you get yourself into Equal Pay Act problems. You have to, if you have similar positions, they have to be paid similar wages. So they're within the same grade. There's a 4-step variation that they could potentially do within budget. I don't know what the practice has been, but I do know that they give those employees increases when they come back year after year.
And so when do we have to negotiate again?
We have 1 more year, so
Okay.
2020, this is
2021 into 2022?
2022 is already decided. We'll start negotiations in 2022.
For 2023. Okay.
I will let you know that HR and Ms. Elwine have put together a spreadsheet now so that if you want to know how many full-time employees, part-time employees, and who works where, you can go in and search these things and find it out very easily. So
We used to have to look in 4 different places. It's all in one now. It's great.
we're streamlining a little bit.
Is that on the website or available? Or can it be, or is there's some law against that or something?
I have it.
No.
I don't know.
Do we have that now?
It's just the way
They put it together. You were doing
You
a
already
few
do
tweaks
that
to it.
every year at the beginning of the year.
Right.
You're
But I'm
required by
talking
law.
if the public wants to look.
The way that it's currently formatted, I don't think that you'd want all of that information to be readily accessible.
I'll ask you this, how many employees do we have,
Well,
full-time?
We technically have 100, well, now we've eliminated 2, so our count went down 177 or 175.
Okay.
That's just full-time employees.
Right.
It's not full-time equivalent, it's just full-time
Full-time
employees. Because
employees.
you have a large number of seasonal part-time, that goes up to almost 400. So,
And I think council could have the spreadsheet if they
Yeah,
wanted to be able
absolutely.
to see how many employees are where and be able to search names, which is nice because I hear names of people and I'm like, right, I don't
Yep.
know exactly where they work. So unless I hear their name a lot, then I get a little concerned.
Yeah.
I'm hearing their name a lot, so.
oops, sorry. And actually, even just having the number of budgeted positions for the part-timers for each department and division is going to be really helpful for next year's budget. We can just push this back to all department heads, and then they can just update for upcoming years. So it'll make things a lot easier to figure out.
Second. Motion by Mr. McCardle, second by Mr. Rice. Further discussion. Anybody in the audience wish to address this? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve resolution R 2020-84, plat of Lot 8H, Block 7 Westward, First Edition, subdivision southwest quarter of Section 16, Township 103 North, Range 60 West, 5th Prime Meridian, City of Mitchell, Davis County, South Dakota. Mr. Putnam.
Thank you, Mayor and council members. This plat was presented to the council, or to the planning commission at their last regular meeting, and did recommend approval with, if you had a chance to look at the minutes, you'd see that we did ask for some elevation material and some drainage information. That information has been provided to the engineer's office, so we just haven't quite figured out exactly how we're going to record it, but nonetheless, the information has been supplied, so I just wanted to make sure if you did notice that. Correct,
Yes.
as well as the next one is too.
The conditions have been met, is that?
Yeah, they have submitted the appropriate information to the satisfaction of.
Okay, I'll move approval of resolution
Motion by Mr.
2020-84.
Rice.
Second.
Second by Mr. Allen. Further discussion? Is there anybody Any audience wishes to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Resolution R 2020-85, plat of lots 8A, B, C, D, F, Block 7 Westwood, First Edition, Subdivision Southwest Quarter, Section 16, Township 103 North, Range 60 West of the 5th Primary Meridian, City of Mitchell, Davis County, South Dakota.
Again, this plat was presented to the Planning Commission and did recommend approval. As you can kind of see, the north part, those are already under construction, or I mean, already completed. And the one to the south is under construction as we speak. So what's happening is they're subdividing the purpose to the north, and then would be a large one to the south, and then at some point, my guess is that they may be subdivided into various units as well. This is the information that we were just referring to in the first one. It was already submitted prior to the building permit.
Move
Move to
approval of
approve.
2020-85.
Second.
Motion by Mr. Rice, second by Mrs. Charks. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Resolution R 2020-86, plat of lots 9 through 11 in Tract J, Wild Oak Golf Edition of the City of Mitchell, Davis County, South Dakota.
Again, this plat was presented to the Planning Commission and did recommend approval. You can kind of see that it follows the master plan right there off of the cul-de-sac.
Move approval.
Motion by Mr. Rice, second by Mr. McCardle. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Resolution R 2020-87, contingency transfers. Ms. Elwine.
Mayor and council, I did hand out a revised contingency resolution. I'm going to pull that one up on the board. The item that's highlighted would have been changed since you received your packet or it was posted online. I did provide a staff report that gave the background for each of these items in your packet. The first one, community contributions, is for the fundraising campaign for the Friends of Fire Steel. Any of the ones that you see compensated absences would be due to retirements in those individual departments. Fire department, we had a repair to the roof of the public safety building as well as the HVAC system on that second fire station that we were having problems with moisture. I went right over these other ones. I'm so sorry. The police department was the roof repair. We did add $20,000 for repairs and maintenance. As you are probably aware, we had an incident over the weekend that resulted in 2 of our police vehicles getting damaged. So we're going to need to get those repaired as quickly as possible, and if they can get that done in 2020, we may not have reimbursement yet back from our insurance provider, so that allows them to get those repairs done. And we also had a boiler repair that came up. That should be, I think we were estimating between the quotes that Mike got and then the repair quote was close to $10,000, but this would be just because those were pretty quick quotes they got today on the repairs to the vehicle, so there might be something else that they find that we didn't know about. Again, compensated absences, those are normal. The last one, Burr Street, my understanding is that is a payment to the state. When I pulled up the budget from 2019, there was that money left over in that line. I don't know why it wasn't requested to be supplemented into the 2020 budget, but it was there unexpended, so we do need to get that paid to the state. So again, the one that's highlighted would be the change from how it was published, but we need to get that done by the end of the year.
I'll move approval of contingency transfers as amended to include the new $20,000.
Second.
Motion by Mr. Rice, second by Mr. Barrington. Further discussion? Anybody in the audience wish to address these? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Action to approve Resolution R 2020-88, resolution amending the city's rate structure providing for a surcharge for improvements to sewer system for payment of a revenue borrower bond and yearly review of the rate.
Mayor and council, earlier this year, the council took action to do rate increases in September and then again in May of 2021 to fund upcoming projects that were identified both in 2020, and then some of those kind of will carry forward to 2021. This resolution is not changing the rates that were already established by the city. What you're doing is you're taking part of those rates and you're segregating it out once we collect it to pay off, to set it aside for the surcharge that's tied to the debt service that you've already approved for the project. So this would be for East Central Drainage Phase 2. You will probably see another one. The next one that probably will come up is West Harmon Utilities, I think is the next application that's that close. So again, it's not changing any rates that the council's already approved. It's just segregating out part of that collection for the surcharge for the repayment of the debt. By doing a surcharge, that's how we're allowed to keep it into the 10% debt capacity instead of the 5%. Excuse me, I take that back. It actually lets us take it off our debt capacity altogether. So that's why we do the surcharge. If you have any questions, I can certainly answer them for you. The resolution was drafted by our bond counsel to meet the legal requirements for the bond as well as the requirements by DENR.
And just to confirm, East Central Drainage is down by the Clockworks and.
Yes.
Yep, it's that
East
second
Central
phase.
two.
Yep, south of Norway. No, that's not Norway. That's Havens, the big street. Sorry.
South Havens,
Yes.
north of Norway.
Yes, and that is also why we dissolved the TIF, that TIF district, because we are using the SRF financing for the project, and in addition to the grant that Public Works was able to get for EDA.
Move to approve.
Motion by Mr. Allen. Second by Mr. Rice. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Second reading of ordinance 02020-15, supplemental appropriations.
Mayor and council, included in your packet is the ordinance. There was one change from the first reading. It is not a substantial change, but under the supplies, under municipal buildings for COVID, before you would have seen a number that said 50,000. In reviewing, there were some journal entries that were made for some purchases that occurred before, it was like May and June, and it was before, they did the journal entries after I had already calculated what we would need for the end of the year. So this would allow us to cover all of those costs. Basically, I didn't know there was another $15,000 coming through when I originally estimated what was needed. Again, this is coming from CARES Act funds, just getting reimbursed for what we already submitted. Anything that was paid out of this line has already been reimbursed by the state through our CARES Act allocation.
Move to approve on second reading.
Motion by Mrs. Charks. Second by Mr. Rice. Further discussion? Anybody in the audience wish to address it? All those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion. Second. Carried. Motion by Mr. Smith to adopt, second by Mr. McCardle. Further discussion? Roll call.
Chart. Aye. Smith.
Aye.
Sabers. Rice.
Aye.
Dosher. McCardle.
Aye.
Barrington.
Aye.
Allen.
Aye.
Motion carries. Second reading of ordinance 020-2016, creating the Golfin Cemetery Board.
No changes from last meeting. Again, it just formally creates the Golf and Cemetery Board, since it was kind of a ghost in the system, so.
And just as a clarification, this doesn't do anything to the decisions that were made or recommended to us by that board prior to this making them official?
No.
All
No,
of those things stay in place, correct?
Yeah, this would not have any impact on organization of the Golf and Cemetery Department. It's just solely for the board and their roles and responsibilities.
Motion by Mr. Sabers. Second by Mrs. Charks. Further discussion? All those in favor? Whoop. Anybody in the audience wish to address it? You sure, Mr. Gadari? This is your chance. Okay, all those in favor of the motion signify by saying aye.
Aye.
Opposed, nay. Motion carried. Motion to adopt.
Move to adopt.
Motion by Mr. Allen, second by Mr. McCardle. Further discussion? Roll call.
Sabers. Rice.
Aye.
Dosher.
McCardle.
Aye.
Barrington.
Aye.
Allen.
Aye.
Chark. Smith.
Aye.
Motion carries. One thing I want to bring up real quickly, I forgot, I meant to do it under public commentary. We did get a $20,000 grant to do the windows in the western building. So Mr. Croce was awarded $20,000 to help with that expense. So the western building on, Crafty Fox.
Actually, Neil Putnam worked with the state on getting the Deadwood grant.
Yep. Okay, we're adjourned.